Hello, I'm Dr. William July, clinical psychologist. I get a lot of questions about adult ADHD, so I have put together this little video to explain more about it. First of all, don't self diagnose. Get a real psychological evaluation by a real psychologist. This gives you the opportunity to get a good differential diagnosis of what it is and what it is not. In the evaluation, the first thing we're going to do is a clinical interview of your symptoms and history. I'm also going to want to do some profile testing to get an overall view and an overall picture of how you function. There will also be some ADHD questionnaires and one for someone who knows you well as some computerized psychological ADHD testing. For diagnosis, you actually have to meet a pretty significant criteria in two areas because we want to make sure that you're really experiencing ADHD. One of the three types. There are three types. The inattentive presentation, you see some examples of that on the screen, some of the symptoms from the DSM-5. Also, predominantly hyperactive impulsive type, you see some examples of that on the screen. And there's the combined type, which is when an individual is experiencing the inattentive as well as the hyperactive impulsive types all together. Sometimes secondary issues such as mood and anxiety are exacerbated with ADHD, self esteem, and other issues. But the only way to really know if you have ADHD is to have an evaluation by a psychologist or a medical professional. So let's get a real good clinical picture and see if it's ADHD or not. Feel free to reach out to me for more information by email. I'll be happy to respond to you.